Hello and welcome to the East Sussex Healthcare NHS Trust orthopaedic pre-assessment video. This short video will provide you with information on what to expect before and after your knee replacement, so you can be best prepared for your operation and achieve the greatest recovery possible. We hope it will reduce any concerns you may have about the operation. However, there will be an additional one-to-one session with the therapy team if you have any unresolved questions. We appreciate there is a lot of information to take in. Therefore, this talk will be available on the Trust website and in the information leaflets provided. Physiotherapy is a key part of the rehabilitation process and recovery after your operation. It is important that you start moving your joint as soon as possible to regain your movement and reduce stiffness, increasing the strength in the muscles around the joint and improve your circulation. Not only that, but getting up, out of bed and mobilising as soon as is safe to do so can reduce your length of stay in hospital, and therefore we will aim to do this on the first day after your operation. In some cases, this may be possible on the day of the operation if you are back early enough from surgery. Remember, while the physiotherapy team will help you with your rehabilitation, it is important you take an active role in your recovery. This video will help you to understand how you can do this. In your booklet, you will see there are a series of exercises. These exercises will be shown later, and these should be started before the operation to optimise your movement and strength of the joint. After the operation, it is important you start these exercises as soon as possible to reduce pain and swelling and increase movement. The physio will go through these exercises with you again post-operatively, but it is your responsibility to practice them 4 times a day, both in hospital and at home. Remember, your compliance to these exercises will greatly impact your recovery, allowing you to move and walk as well as possible. To help with keeping you on track, an exercise sheet will be provided, and you should continue your exercises for at least 6 months. Hi Helen.
Good morning.
We're just going to run through your exercises after your total knee replacement now. So here's the exercise sheet for you to have a read through.
Thank you.
So the first exercise that we have here is just some ankle pumps. So just nice brisk pace there with the feet, just moving them up and down. That just helps with the circulation in the lower leg, getting that blood flow going, and this can help regulate your swelling as well. Okay. Aiming to do about 20 foot pumps in one go. Okay. The next exercise, we're looking to get your knee going nice and straight down into the bed here. Okay. So what you want to do is pull the ankle of the operated leg up towards you, and you want to tighten the muscles in the front of the thigh, so you're pushing the back of your knee down flush with the mattress, and that's achieving a fully straight leg there. Okay. This one's nice and important because it helps keep your leg nice and strong when you're looking to walk around. Okay. The third exercise on the sheet there, we've just got this rolled up towel that I've prepared for you. Okay. This is just going to go underneath your operated knee. Okay, and just relax back down onto there for me. Again, similar idea, you're going to pull that foot up towards you, push your knee down into the towel, and we're looking to lift that heel up off the bed there. Okay, again you should feel the muscle at the front of the thigh tightening up. Lovely. And one more like that for me. Brilliant. Okay, I'm going to pop that towel out the way now. Turning over the page on the exercise sheet there, we've got one where we're starting to look to bend the knee. So you might find that you want to use a carrier bag for this to take the friction out of the bed, but in hospital we can use a plastic apron. This is just going to go underneath the foot, okay? And with this exercise, what we're looking to do nice and slowly is bend the knee and the hip up, so you're sliding that heel up towards your bottom, okay? That's it, lovely. Looking to push into a little bit of discomfort just to force it, but not too painful, okay? And then back down the bed. Again, nice smooth movements with this. Up again, one more for me. Lovely, and back down. Okay, and it tells you the number of how many to do for all of these exercises on the sheet. As long as your blood pressure and pain is well controlled, and the doctors have deemed safe to do so, you will be helped to mobilise out of the bed. After a routine knee replacement, the person is normally able to put their full weight through the leg. You will normally start mobilising with a walking frame and then progress onto crutches or walking sticks if safe to do so. Walking aids will be supplied for you to take home from hospital.
We're going to have a walk with the crutches now. Okay, so standing up with the crutches, what you want to do is initially bring them into what we call the H shape, so the handles together like this. Okay, one hand goes onto the handles of the crutches here, and the other hand's going to be on the mattress. Okay, in terms of your legs, you want your unoperated leg slightly underneath you. Okay, and your operated leg, you might just want it out in front just so it's a bit more comfortable there. Really important. What you need to do is push through the surface that you're leaning on, so pushing on the mattress, pushing on the crutches, pushing mainly through your unoperated leg. You're going to bring yourself up to stand, okay, and then just popping your hands in through the handles, in through the holes onto the handles. Bring the crutches apart, slightly wider than shoulder width. Bring the crutches out in front of you first of all, then the operated leg's going to go forward, and then the unoperated leg to the same level or just beyond, and then the crutches forward again. Operated leg, unoperated leg to the same level or just beyond, and just repeating that process. And so then when we're turning, we want to keep the crutches still nice and wide, stepping into the middle of the crutches throughout. Okay, you want those handles facing forward at all times. Okay, and we're just going to head back towards the bed. Lovely, so you want to keep your operated leg nice and straight, nice and strong underneath you as you step your unoperated leg forward. Lovely, and then just coming to sit back down onto the bed. So you want to turn with plenty of room so you're not twisting and keeping those crutches wide apart. You want to back up until you feel the bed up against your legs, okay? And then again, it's the reverse process of standing up. So you want to bring the crutches in front of you so the handles are together to form that H shape. And then you want to reach one hand back for the mattress, and you probably want to slide your operated leg forward slightly and then gently lowering yourself to what you're sat on. Lovely, well done.
If you have stairs or steps at home or into your property, you will be taught the correct technique to carry this out safely. This is often a lot easier than expected, and the physio will practice this with you to ensure you're safe and feel confident before going home.
Okay, Helen, so we're going to have the go at the stairs now. Okay, so you want to be holding onto the banister because that's the side you've got the rail at home. Crutch in the other hand. Okay, and the order for the stairs is nice and simple. It's A, B, C. So the order is A, B, C. So able leg, bad leg, crutches. A for the able leg, B for the bad leg, C for the crutch. One step at a time. Lovely. And then we're going to turn around and come back down. So swapping the crutch over to the other hand, holding onto the rail here. It's the reverse order coming back down, so it's CBA. So the crutch comes down first, then the bad leg, then the able leg. Crutch, bad operated leg, and then the able leg. Lovely. Okay, so just practicing the steps to get into your property now. So you don't have a rail on those, so we're going to use a crutch in both hands now. Okay, so it's exactly that same order, A, B, C. So A is your able leg, your right leg, then your bad leg, your operated left leg, and then both the crutches up onto the step. Able leg, bad leg, crutches. B, and the last C. Lovely, and then we're going to turn around, come back down. C for the crutches, B for the bad leg, A for the able leg. Crutches, bad leg, able leg, crutches, bad leg, able leg. Lovely.
Good footwear is very important. Please ensure your shoes or slippers have a back on them to prevent them from slipping off. This is much safer going up and down the stairs and will help you to walk with a better pattern. Although tempting, try not to buy brand new shoes or slippers as your feet are likely to swell after surgery and it may be difficult to put them on. Any joint surgery comes with a few common problems post-operatively to be aware of. It is normal to have pain after your operation, which may last for several weeks to months, especially in knees. Therefore, it is vital for your recovery that this is managed as well as possible. Controlling the pain will allow you to carry out your rehabilitation, including the exercises and mobilising more effectively. If you feel your pain is not managed or controlled, then it is important that we have this reviewed. It is also very important to manage swelling after the operation. In general, we recommend a resting period midday after your knee operation. When sitting out, knee replacements should rest their leg on a footstool intermittently throughout the day, ensuring their ankle and knee are level with the hip. Completing your exercises will also help reduce your swelling. We recommend that you have a packet of frozen peas or an ice pack in the freezer ready to use at home. Cold therapy helps to reduce swelling, inflammation and pain and allows you to move your joint more effectively. This can be provided whilst in hospital. In order to reduce stiffness, it is extremely important that you complete the exercises mentioned above. Completing your exercises will reduce stiffness, increase movement and therefore reduce pain, allowing you to walk comfortably, regaining a good walking pattern after surgery. After knee replacement surgery, the aim is to increase your range of movement to 0 to 90 degrees within 2 weeks. It is extremely important that you do not rest a pillow or towel under your knee, as this will put you at a high risk of not regaining the ability to straighten the knee, which can greatly impact your walking. The only time you should have anything underneath your knee is during the exercises. The average length of stay after a routine knee replacement is 1 to 2 days after your operation. If you are having a unilateral knee replacement or just a kneecap resurfacing, this is normally 1 day. You are safe to go home from a physiotherapy perspective once you have achieved your agreed discharge goals and if you are able to mobilise safely and confidently. Occupational therapists, nurses and doctors need to be happy too, but most importantly, you need to feel able and confident about coping at home. Following your discharge from the ward, you will be contacted regarding your therapy follow-up, which is normally 1 week post-op.